forward, and he said he just texted back and said, yes, he'll be on in a minute. But I think you can go ahead and at least kick the meeting off.
All right, no problem. All right, so I'm going to call for the Board of Health meeting on August 10, 2020. And I would like to ask everyone to identify themselves for the record. All board members.
Landry Fagan, board member.
Mackenzie Reeder, board member.
Morgan McMillan, board member.
And now for the staff.
Jeff Zayak, Boulder County Public Health Director.
Susan Motika.
Mario Barron, Budget Manager.
Joe Malinowski, Environmental Health Division Manager. Good evening.
Nadine Bridges, she, her, hers, Community Health Division Manager.
Erin Dodge, Water Quality Coordinator, she, her, hers.
Celeste Gleason, Environmental Health Water Quality Specialist.
Indira Gujral, Communicable Disease and Emergency Management Division Manager.
Amy Golden, Business Operations Manager.
Andrea Pruitt, Family Health Division Manager, she, her, hers.
Right, so like everyone else. That's it. So item number 1, public comments. Anybody from the public?
Yeah. I'm here. This is Jeff Thompson, and I live in Longmont.
And let me ask.
Pardon me?
Are you gonna comment on a unscheduled agenda item or one of the agenda?
Well, actually, what I want to comment on is what has been missing from the agendas since the pandemic began, and what should be on the agenda, and what should be on the agenda prior to any discussion of budgets for either 2020 or 2021.
Okay, great. So you will have 3 minutes to speak, and
okay.
When the staff can actually take time, please. Tommy, maybe.
The first thing is I would like you to tell me and tell all the people of Boulder County what is the plan to suppress this coronavirus in Boulder County, which would include, how do you define suppression? There are various ways that suppression of the virus is being defined by a lot of different very credible institutions. And I think that needs to be discussed, and you need to establish what your goal is so we know what you're doing and what you're trying to do. And of course, the second part of that would be, how do you intend to get there? Tracing and testing, of course, would have to be a very large part of that. But what I've been able to gather is that your tracing and testing efforts are woefully insufficient. I'm primarily referring to information that I'm getting from the Harvard Global Health Institute and the National Association of City and County Health Officials, and Johns Hopkins, and a very credible, widely acknowledged expert, Lori Garrett. And you should be able to do to tell me exactly what you're trying to do to suppress this virus. And of course, the most important question is when will we get there? When can we say that this virus has been suppressed in Boulder County, which the most widely used measure of that is that we would go 2 weeks with no new cases. I don't know how I'm doing time-wise, and I think 3 minutes is way too short.
One more minute.
Well, it just appears to me, I've read all the minutes of all the meetings to date since the February meeting. And the board appears to be woefully ignorant of what can be done and what should be done to suppress the virus in Boulder County, and doesn't seem to have any intention or even any interest in doing it. All these board meetings, not one good question has been asked by a board member, and it's just incredible. It's like you don't care. But the second major thing I would like you to address is, would you please, by motion or resolution in this meeting, categorically deny that this board or the county staff has ever suggested to the Longmont police officials that it is okay not to enforce county or state health orders. And the reason I'm asking for that is I've made many calls for service involving violations of the health orders throughout this pandemic. And every time they transfer me to a sergeant that has been assigned to address this sort of complaint, and the sergeant always tells me that Boulder County public health officials have agreed that their orders should not be enforced, that they should only take an education role. Well, our police officers are not trained as teachers or educators, and they have a duty to the people in Longmont, like me, who pay taxes and this sort of thing, to enforce these health orders to protect us. And 3 times you can investigate. I would like you, if you won't categorically deny that anyone associated with the health department or this health board has even suggested that the health orders not be enforced. And violation of a health order, as you should know, it has been declared by the Colorado Criminal Code to be a misdemeanor, and there is a minimum sentence, which means violation of a health order is a very serious matter. And yet the police consistently tell me that they have been told by Boulder County health officials not to enforce their health orders, which would mean that Boulder County health officials are interfering with the enforcement of the law, which is probably a crime in and of itself. So would you please tell me, what is your plan to suppress the virus, and how does that relate to the budget? Because what I know would take a lot more than 4 minutes to explain to you why this is so. But I haven't seen the budget. I just think that's kind of rude to not put that budget online before you discuss it so members of the public like me can look at it. It's not online anywhere. I haven't been able to even see it. But I can tell already by some of the comments that have been made by the director in past meetings that the budget is woefully inadequate to suppress the budget. It doesn't provide for enough adequate testing and tracing, specifically, by standards that have been set by credible institutions. And I'll let it go at there. I'll let it go at that. But because basically I'm at a loss for words. I've read all those minutes. I read the minutes of the July meeting last night, and I've been in a state of shock since last night. It's why I'm not very well prepared, to make my comments now, because it's like I'm speaking into a vacuum. There's no evidence coming from any of those meetings that there's anybody on this board that knows anything about its responsibilities, its duties under the law, or anything about how to carry out those responsibilities and duties. And there's not even anything that shows that anybody on the board even cares.
Right, Sarah. Well, thank you. Thanks so much.
Let me ask one other quick question. Like the numbers that came up online today show that you've detected, as of today, 1,210 cases, which the CDC says if you've detected 1,210 cases, there's at least 12,100 people infected in Boulder County as of today. 12,100 people infected in Boulder County as of today. Would you at least tell me how many of those 12,100 people minimum have been quarantined or isolated? Because if you can't give me that number, then you don't know whether or not your efforts have been anywhere near sufficient. And you're also showing that you have in progress 142 disease investigations, which would strongly suggest that you have a long backlog, that you're not completing these disease investigations nearly quickly enough, which means you don't have enough contact tracers in this budget. You can't come up with a budget, though, unless you have a goal, unless you know what you're trying to do with the budget, and you've never established that. So would you do that first in this meeting before you have any discussions of the budget? And also address the issues so I can make it clear, or you can make it clear to the Longmont police that they do not have the permission of the health boards, do not enforce the laws. That's it, or I'd have to go on and basically try to educate the board members on how the virus is being successfully suppressed in places in this country and all over the world, and how disgusting it is what a backwater the county commissioners have allowed Boulder County to become by basically tolerating the inaction and basically the ignorance of this board.
Thank you for your comments.
If you have any questions, I can back up what I just said. If you have any questions, I'll stay on here and you can ask the questions and I'll try to answer them.
Thank you very much for your comments and your input.
Yeah, thank you, sir.
Hey, everybody, this is Greg. I'm on. Sorry, I'm not exactly sure what's happening with the teams here, but I'm on. So thank you.
Could I just ask for one more thing? Would somebody establish contact with me so I can talk about some of these things that I've brought up? I can't get, I've requested, but I've been denied any information how to contact any of the board members. And Mr. Garrett lives in Longmont, as I understand it. I think it would be really good if I could talk to him about some of these problems and make some suggestions to him as to what Boulder County should be doing to suppress the virus. That there seems to be a wall up that the board members don't want to have any contact with concerned citizens like myself. So if you would just call me or email me, Mr. Garrett, my number is 720-818-6212, 720-818-6212. And my email is jeffthompson2011@hotmail.com. So that's simply JEFFTHOMPSON2011@hotmail.com. And if any board member will establish contact with me, I would be happy to go over what I've learned. And it's available to everybody. All you have to do is do a search for COVID-19 or COVID, and you will see what all these major institutions are saying has to be done to suppress the virus. And you will see that you're not even coming close to it. And you're just basically riding along, not even making any suggestions to the state authorities as to what Boulder County thinks needs to be done at the state level. And it seems that from reading the July minutes, what they're doing at the state level, the primary goal is not to have too much of an impact on the state budget. And you have also the goal of not having an impact on the county budget. But,
okay, this is great, Thomas.
The implication of that is that, but let me finish. The implication of that is that you couldn't care less about all these people that are dying. So that I'll shut up.
Yeah, that's absolutely improper. Your 3 minutes are over.
That is absolutely
I will reach out to you. But having worked response for Denver County Public Health and watching Boulder County Public Health over that same time frame, we are doing a lot of the things that we can do. And so, anyway, thank you for your comments. We need to move on to the agenda.
If you have any facts to back up what you just said, please call me and give me some facts, or give me those facts in a meeting, because all the facts that have been made available to the public indicate the opposite. They indicate that at the state level and at the county level, nobody could care less about the people that are dying.
We have to move on to our regular agenda items. So thanks, Jorge, or I'm not sure who was leading the meeting while I was not present, but thank you. All right, so Tammy, we need to do the official introduction?
We already did.
Okay, we already did it. So which agenda item are we on now, Jorge?
We should be moving to approval of the July 13 minutes.
Okay. All right, so any questions about the approval of the regular meeting minutes of July 13th? And if not, can I hear a motion?
This is Morgan. I move to approve the July 13th regular meeting minutes.
Second.
All in favor?
Aye.
Aye.
And sorry to ask this again. So Morgan, Jorge, who else is on the call from the board?
Mackenzie is on the call.
Hi, Mackenzie.
Hi. Landry's
Okay,
here too.
Oh, okay.
Sorry,
Perfect.
I'm on the call too. I just had to step out.
Thanks, Landry.
Okay.
All right, so item 3 is the discussion on the proposed on-site wastewater treatment fees, OWTS. And so who's leading that one, Jeff?
That is Aaron, and Aaron is here. Aaron.
Hi, Aaron.
Hello, everybody. Erin Dodge with Environmental Health, the Water Quality Program Coordinator. And thank you for your time tonight. Our goal tonight is just to present to you the plan and get your sort of your feedback on the way we're looking at doing these fees, and then we'll actually bring the fee schedule back next month for approval. So today we're just looking to get any feedback you have on our process. And then, as I said, next month we'll come back for approval. So for anybody who's on the computer and can see a screen, I'm just going to share a slide, but you don't necessarily need to see that because I know some of you are on the phone. So some of you will remember that we came to the board last year, I guess it was just about a year ago, and with a proposal to raise fees and adjust some of our fees. Our minor repair went down a little. And at that time, we were still limited in the ability to raise our major repair and our new construction permit fees because they were still set in state statute. They were capped at $1,000. And since then, that has gone to vote with the Senate and was passed that was actually taken out of state statute, and local public health agencies have the ability to set those fees in an effort to recoup actual cost of the program. So that is why we are here tonight. We're just specifically looking at the major repair construction and the new construction permit. And the other thing that's happened in that time frame from the last fee was that we actually have a new and improved database. So that presented a different challenge for us in analyzing the fees because we don't have the level of detail that we can pull out of our new database is not supported by with longevity. We only can see back to about a year. So that was something that we identified as a challenge while we were doing this analysis for the fees. So the first thing we came up with was we actually looked at the total average time it took us to complete a permit. And that included all inspection types, all workflow processes, every touch that we had, we're tracking that data. So that came out to be just under 10 hours, which was lower than our previous data had sort of shown us. We were expecting it to be closer to 12 hours. And so the new permit fee based on our existing hourly rate of about $140 would be $1,370 for a new or major repair construction permit. Now, the limitation we saw was that we could only see a total of 61 records because we needed that permit to have been completed in order to assess what the full length of time was to complete that permit. So that was a limitation. And the other limitation is when we came last year with the fees, we actually, say a septic inspection fails and we have to go out and re-inspect it, we created fees where we could charge additional. So these are really, the permit fees are really trying to only capture those inspection types that are included in the permit fee. So that was sort of another error that we identified in looking at the permit data this way. So the other thing that we looked at was if we took the average time for each task and totaled those up, it put us closer to what our previous data had shown us, that in our old database, that it put us at 13 hours per permit. But the permit, it felt a little high, and the permit jump to $1,800 felt like a lot. It's greater than 100% increase, or close to, for that permit type. But we were able to use 172 different records to look at that data, and we felt like it was definitely more representative. We were able to take out those types of inspections that we would charge additional fees for. So what we're recommending using for the analysis is an actual average of those two permit types, and then we can continue to monitor this and adjust our fees annually. So my recommendation is that we come back to you every year. And it might just be, hey, we don't see any need to make changes, or we can adjust those up or down based on the addition of data. But we definitely wanted to get some feedback from the board because, things are a challenging time right now in the community. But we also want to get closer to cost recovery. This probably puts us, if we were to be able to utilize this sort of scenario to the $18.15 per permit, it would put us closer to cost recovery for the program, but definitely not 100% cost recovery. One other thing to note is I am working with Marielle and Megan to readjust our hourly fee because we have had some staffing changes that could potentially impact that number. So these numbers may increase or decrease a little bit based on our hourly fee.
Thanks, Erin. This is Greg. Hey, so I see you have the number of records included in that analysis. How many permits do we do a year?
So we do about between 250 and 300 permits per year. So, but of this, that's for all permits. That's including minor repair that we're not looking at adjusting that rate for at this time. So this is just looking at major repair and new permits. So probably about 170. So closer to what we're seeing in the data set in scenario 2.
Okay.
Hey, Erin, this is Morgan. I've got a couple of questions for you. About out of those like 250 applications or permits that you see, do you have an idea? I saw in your what you'd sent out for the board packet that it includes sliding scale adjustments for homes or households that qualify. Has that always been the case? I mean, do you have a sense of like what percentage?
Yeah, so we have offered that since I started working with the program in 2014. It was in place prior to that. I don't know how far back, but I would say we probably process maybe 10 or less per year using that sliding scale.
And do you think that's because most households don't qualify, or do you think that people just aren't aware of the program? I guess like how much are folks aware of it?
I would say it's probably a combination. I do think that there's probably a lot of folks that might not have, be rich in the bank per se, but in order to qualify for that, it probably wouldn't work for them because it's looking at your total assets. It's following what HUD uses, sort of their protocol. But I also do think, it is on our website and we do mention that to people, but I don't think we don't necessarily advertise that sliding scale option.
Okay, thanks. I guess my other question is sort of in looking at the comparison that you sent with our surrounding counties, and obviously the increased amount is a great deal more than our surrounding communities, and so can you speak to that? Do you think that other counties haven't increased their fees or made adjustments since the statute was changed, or do you think that our costs are higher in Boulder County? Just trying to get a sense of why ours would be significantly higher than surrounding communities.
Yeah, so the comparison that was left over is we would be one of the first counties probably to have the ability to make that increase. I do know that Jefferson County would like to, but I also know their staff are still pretty heavy in the deployment for responding to COVID. And Tri-County is working on that as well. I do think that there's a big difference in how the hourly cost is calculated. I know that the food program also saw that as a challenge during their fee increases, that how we would calculate an hourly fee includes benefits and more of like a total program cost versus others are looking more just at a salary dollar. I know we have asked out to the rest of the counties, and I know Joe was mentioning to me today that Pitkin County was looking at increasing theirs, and it would be higher than that $1,500 for sure. I think they were looking closer to $2,000. So I think that we're just ahead of the curve to longly answer your question.
Okay, thanks for that. I don't know if other board members have additional questions. I'll say that, anytime you see a 63% fee increase, you're like, ooh, I wonder how that's going to affect people. So I appreciate that you're looking for feedback on it. And I guess, a question would be like, do we have the ability to gather any feedback from the folks who are going to be doing the work? I mean, I appreciate also that Boulder County needs to recover costs. So I don't want to diminish the importance of doing that. Just it looks like a big increase on paper, and so just wanting to be mindful of how this is going to affect people, and especially at a time when a lot of people are being financially hit. So those are my comments there. Just if you're looking for it.
Yeah, no, absolutely. Why we wanted to come first and get some feedback.
When would you look at implementing this, whenever you make that decision?
So we were hoping to bring it back next month for board approval, and then it would be, I think there's a waiting period after approval. So hopefully sometime in September it would take effect.
Okay. And the total estimated revenue generated is?
I knew you were going to ask me that question. Let me stop sharing my screen.
The 170 times 200?
So, no, not quite. It would be about an additional 100. I want to say it was about an additional $100,000 to $140,000 per year.
Right. That's good enough for now.
Yeah, and it would be. We did promote Celeste Gleason, who's on the call, to our team lead for this program, and then we will be backfilling that position. And the goal is that the fees would be 100% covering the cost of that additional staff member.
Okay.
This is Joe Malinowski. I think it's good to keep in mind that although we are increasing the fees significantly, we've been bearing these costs for years. It's just the statutes have changed in the last legislative cycle to actually allow us to get full cost recovery. So I know it's a big impact for the citizens that may be installing a septic system or repairing it. But for us, we've been bearing those costs for years.
And that's a good point, Joe. And so the permit fee that we're, let's take any of those numbers that you're proposing, 1593. It's usually always related to some kind of improvement that's being made to the system, right? Most people don't seek out a permit when they don't need to make any improvements. And so you have a sense for what the average cost for a repair of a septic is? Or is it all so varied that it's probably not a good question?
No, actually, you just read my mind. I was going to share that information as well. So the average cost of installation in our of a septic system in our county is it's very wide, but it's anywhere from about $15,000 to $50,000. I would say on average, they're probably in like the $30,000 ballpark. So when you think about that cost compared to that permit fee, not minor, definitely not a minor drop in the bucket, but comparative, it's definitely.
Okay. So like anywhere from 3 to 10%, depending on, the complexity.
Right. And
Okay.
if they're just doing a small repair, that permit fee, again, is only $1,000. And then we also added even more minor repair, opportunity for like a $500 permit for other small repairs.
All right. So we will wait to see you again next month. There's no action that's required by the board at this time.
No action, just we were just looking for your feedback, so we appreciate it.
Okay. Any other questions from the board?
And just to be clear, I believe that is a public meeting, so we'll be posting this information prior to the meeting, and we may have citizens that may want to come and participate. So.
Yeah, and we will definitely be letting the industry know and sharing that information out on our website as well. So. Well, thank you all very much for your time.
Thanks, Aaron.
Thank you.
Thanks, Aaron.
Okay, let's see here. So item number 4 is resolution 2020-01, approving the Boulder County Public Health 2020 amended budget.
And Greg, I'll kick it off here. I don't know that you've all yet met Marielle, who is our Director of Administration and Finance. Marielle's been with us since December, and we were lucky enough and unfortunate enough for, I know, Robin Bohannon to steal Marielle from Community Services Department. And Marielle came into the department when we were going through, as you all know, a pretty intensive Oracle transition, and has been with us a very short time in that Oracle transition before she was then thrust into the finances of COVID on top of everything else that we were doing. So I just want to thank Marielle so much. She's certainly been working very, very diligently, long hours to pull this budget together, and she's doing it in the midst of a lot of still Oracle transitions, as you hear about a little bit more here, as well as COVID on top of that. So. And we are rehiring our finance manager position. So administration is still down a position there, but I am very appreciative and very happy to introduce you all to Marielle, and she'll take the lead on both this budget item and the next budget item that we're going to be talking about tonight. Marielle, it's all yours.
Well, thank you, Jeff, and hi, everyone. So like Jeff said, I'm pretty new, so we'll just go with the flow and take it from there. So the first thing to take is the 22, and I will share with you the PDF so everybody knows where I'm going to, and hopefully everybody could see my Board of Health communication for the amended 2020 approved budget. And I'm going to just basically highlight some of the increases and decreases for 2020. Well, as you know, due to COVID, we had a couple of grants coming in to support COVID-19 work. As you can see here, we have from CDPHE quite a few buckets of money. We have our FIP, which is our emergency preparedness. We got an epidemiology grant to help us hire and maintain epi positions. We also got a piece of money, which is the $307,000 from the CARES Act, and more recently our ELC grant that covers a lot of the response for the COVID. So those are some of the major grants that came in the past few months just to help us with COVID-19 responses. Some of the more major losses for 2020 were the move of PACE and KICP to the county department, which is the Boulder County Office of Sustainability, Climate Action, and Resilience, called OSCAR. So the entire program PACE moved, so all that revenue or those grants that came in through PACE were shifted to a different department. So those are kind of some of our losses for 2020. One that is kind of not a major increase, but it's actually a substantial increase, was the increase of WIC by $32,000. And those $32,000 actually make a big impact to public health because it was actually in a deficit, and the project manager went and requested additional funds to the CDPHE to help cover those expenditures, and that will create that savings for BCPH. From there, as you can see, our budget went from 18.8 to 18.007, and the net decreases about the 800,000, which are mostly composed by all of those PACE and KICP transfers from BCPH to Boulder County. So those are kind of like the highlights of the increase and decreases for our amended 2020 budget. And then as we go down, we go a little bit more in detail as to where those specific pots of money come from. I don't know how much detail you require from this. I'm just trying to give you kind of a more highlight overview, or if you have any questions in regards to the amended 2020 budget. Everybody's good. Any additional information I could provide you from the amended budget?
So this is Greg, and so really the decreases that we knew were coming related to sustainability, climate action, keep it clean, none of that's really changed from earlier in the year, right?
Yes, it actually was not supposed to later on the year, but it was decided on March 26th that that was going to be effective. So it was a short notice, and that's why it kind of looks like quite of a big decrease.
Okay, all right. I think we knew it was coming. I'm just not sure we knew the exact amounts, I guess. So.
Yeah, we didn't know the exact time frame either, so it was a very short, quick turnaround, and it was so early in the year that a lot of that money kind of like left before we could even see it.
Right.
Any other questions? And if not, we basically went over item 3, and we can item 4, and we can jump into item 5.
Maybe I can just make a quick comment here, because I realized from Susan that I mixed both Marielle's and Megan's title, and Megan is not here tonight. She's on a much needed vacation. She is our Director of Administration and Finance, and Marielle is our Contracts Purchasing and Budget Manager. So sorry about that, and sorry about that, Marielle.
No worries.
I was confused. I'm like, wait, where's Megan and the old budget role? But that makes sense. Thanks, Jeff.
Do we need to? Oh.
Resolution.
Do we need to adopt this resolution before we move on?
That was going to be my question.
Yes, please.
I think we do. Okay, so any further questions from the board on this resolution about the budget of 2020 amended budget? Okay, so seeing none, do I hear a motion to approve this resolution?
This is Morgan. I move to approve the resolution 2020-01.
This is
Did I hear somebody second? I thought I did.
Yeah, Jorge, a second motion.
Okay, thank you. Okay, all in favor? Aye.
Aye.
Aye. Aye.
Aye.
Okay, that's unanimous. Thank you, Marielle, and you can continue.
All right.
Which
now,
is just for any members of the public that are on the board. So item 5 is our budget study session. Jeff, is budget study session, that's not like executive, right?
That is correct. The budget study session does not include any public comment, but this is your opportunity to ask any questions, give us any direction in terms of bringing the budget back to you for formal approval, it would be the month after this.
Okay, all right, thank you.
Okay. And I'm going to share the booklet for those of you that are online. And the booklet is quite extensive, but I'm just going to go over quick highlights and then we'll jump over to the PowerPoint presentation, which actually has a lot more in detail of what it's in here. And hopefully everybody could see. And if I need to make it bigger, please let me know. Okay, so this is basically the booklet, and as you can see, it has quite a few pages, and I just wanted to go over quick or some of the highlights. And in the memo from Jeff, you know, it really wanted to highlight some of the funding that we're trying to support, which is the work from home, the mental health, the racial equity and social justice training, the onboarding of COVID term staff, and continuous messages of COVID and public health. One of the big items from the county that is being messaged on is that the county is indicating that they would be a zero operating and salary target, which means that they are not foreseeing any merit or COLA increases for staff, and they are asking us to please do not request any additional operating due to the fact that they're still overseeing what the impacts of COVID-19 is. From there, there is a request for sustainability tax money, and that is being asked independently from the county budget, and Joe is working with Susie Striffel to get those sustainability tax dollars into the budget. And as of August 5th, we were officially working on getting those sustainability tax budgets online. Let's see what else. I think everybody knows her vision and mission. I'm trying to go down the list. I think the book contains more of what we're doing, what we're working on, like the health equity, social determinants of health, climate change in Boulder County. So those are all the things that we are currently working in, trying to use our budget to the best of our abilities and improving mental health. I think everybody's familiar with the org chart of public health and how it's structured. The 2020 budget adoption, and actually all these details are in our PowerPoint presentation. I just want to make sure that I show you guys the book in case you haven't seen the booklet yet, but we will go over these specific details on the PowerPoint presentations where you can actually ask more details about. Any questions from the booklet that I can answer before we jump into the PowerPoint presentation? Okay, take that as a note. So I'm going to stop sharing the screen, and then I'm going to jump into our PowerPoint presentation. Get this shared. Do you see the first slide?
Yes.
Okay.
All right. And I think the first two are mine, Mariel, correct?
That is correct, Jeff.
Okay, so what I wanted to do first is just start off by, I know you're all aware of this, but I think it's important to say it again, that 2020 has been a pretty massive transition for us with COVID-19. As you all know, we were transitioning from 29 into 2020. We had just gone through our strategic planning session with our management team. We had laid out some directions for the organization that are showing up in the strategic plan. We were incorporating climate change. And even though we knew we had some challenges on the plate, we certainly were turned on a 180 when COVID hit Colorado. And that has been a very large focus of ours as we've moved into this year, as you all know. And again, I want to just say that as we went into this and we started in with COVID-19 and we started to learn more of what this looked like, we were still down some positions. We were down our deputy director position. We were down our finance manager position, which is in the process of being hired now, and a few other positions as well. And we've had to carry through that and just respond 100% to COVID-19. We're trying to get ourselves back oriented to doing some more of the work that we know that we had to step back on. And that's going to continue to be a focus for us as we move into this next year as well. As you all know, we will be, we are kind of holding our breath on the vaccine. We will see when the vaccine gets here, how quickly it gets out, what kind of efficacy it has, and how it's building herd immunity in our community. But we fully expect that moving into 2021, we'll still be pretty immersed in the virus and the work on the virus itself. You also know that we have a fair amount of folks that are invested in COVID-19 that have had to step back from their jobs as well and to work on this response. And again, we see that continuing, especially in the areas of the case investigators and contact tracers. We know it's really difficult to find people that want to work hourly. So when we have to ramp up contact tracers and bring them in, and then let them go or back them off from work when we don't have an outbreak occurring, we need flexibility. So we're bringing a fair amount of our staff into that mix so that we can shift them back and forth. And they've been extremely supportive in that process. Without them, it would have been really difficult to continue to move forward. So I really want to stress again how much I appreciate our directors team, our division managers, and our program staff who have just stepped into this 110% and are working extremely long hours while trying to deal with multiple things on their plate. The other thing that we know is going to be a challenge moving forward into 2021, we know that the county is struggling also with COVID-19. And although we're struggling as a county, I do want to reiterate how fortunate I still feel, and we should feel, as we have cities and other counties around us that have not only had to furlough people, but to lay people off. We are not in that position moving into 2020. Boulder County is not implementing any layoffs, which due to loss of funding associated with COVID-19. And I think that's a very positive statement for this county. Our county, as you know, has been a leader in the state, and there's many other counties that look to us in many areas. Janet Peterson did share with us, as Marielle said, that their county will not be providing at this point any kind of merit or cost of living increase. Even when we say that, we know how much that can have an effect on our staff and on our positions, especially knowing the catastrophic effects due to inflation that causes, especially when people are trying to live, especially in Boulder County. So even knowing that that's really difficult, again, we are not in a place where we're having to face layoffs at this point. So I do appreciate our county commissioners and the support they've tried to always provide to our employees. Also, the county's doing several things going into this next year. But as you know, from the last couple of years of presentations, we've had Ramona, or we've had Aaron, or we've had Bruce before that come in and present the county's picture relative to the budget and where things are headed. And they were challenged even before this to try to get the general fund balance up to that $40 million level that was pre-flood, and have been really struggling to move that number back up. And that's important because if there's something else that happens, and unfortunately we had COVID, it stretches that general fund reserve balance at the county even further. So we would have had Ramona or Aaron here tonight, but the county has not yet closed their 2019 books. I'm not going to go into a ton of that right now, but what you need to know is that this is part of the challenges associated with the Oracle implementation and some of the shortcomings of what was promised versus what we actually got. So the county has to close the books within the next few weeks because the auditors need 30 days to complete the audit. So they're not here, but they can come back and we can bring them back if you're interested in having them come back to present to us at another time. So the county is implementing 3 new practices that they've put in place to help recoup funding that can then go back towards building that general reserve fund back up. They have said that all vacancy savings that occur in each department starting in 2021 will get swept and it'll go back to their general fund. The second thing that they're doing is all vacancies that are over a year old are, I'm pretty sure now, all have been eliminated. So if vacancies sit for more than a year, they're pulling the dollars from those vacancies and they're using those vacancies to, again, move that general fund reserve balance up. And then the third thing is they are looking very closely at any new positions or term position extensions. So the county is making sure that when we have an opening, that we justify the necessity of the opening that we have. So we have to talk to the commissioners, we have to get approval from finance. And for all term positions, we have to make sure that we are asking for the term positions in order to be renewed. So they are looking carefully, which they should, at trying to make sure that they're doing as much as they can with their budget. And then Marielle, you can go to the next slide, the agenda slide. So for the agenda for tonight for this, we are going to talk about the 2021 and 2022 state future, or our future. And I'm going to focus more on 2021 because we really don't know what's going to happen in 2022. So you'll hear me focus on that. Marielle is going to go through a budget picture with you that's pretty in depth. And as you all know, you've got spreadsheets from each of our programs across the entire department that breaks our expenses and revenues down for each of you. We're going to talk about the FTE changes that we've seen between 2019 or 2020 and what we're expecting for 2021. And then we're going to talk about what we're expecting with our fund balance in 2020. And the thing that's important to keep in mind here, as we want to make sure you know every year, is that when we're coming to you, this is a snapshot. So we're predicting what 2021 will look like. We're doing the best, taking our best shot at making that prediction. And we will be coming back to you in December with a much more finalized budget that we need to approve before January. So at the end of December, we'll come back with updated numbers. We'll have a much more solid numbers as we get to that point. But I just want to remind you that this is our best guess at this point. So what I want to do is start right on this slide with just talking a little bit about 2021. And as I said, I mentioned to you that COVID is going to definitely dominate us, and we know it is going to dominate us. We expect moving into September, October, November, that we are going to see flu influence mixed in with COVID. And because those symptoms are so close, we know it's going to be difficult for everybody. It's going to be difficult for businesses, schools. It's going to be difficult for people to be able to differentiate between what might be a COVID symptom, what might be a flu symptom. As I know we've shared a little bit with you before, and you'll see in one of the slides that are coming up tonight, we are hiring some immunization positions, and that's because the state recognizes that challenge as well. And they're putting some immunization funding into specific programming so we can do as much as possible to get the immunization message out and to get immunization for flu completed before we hit that fall timeframe. So there's a lot of focus on that across the entire state. And there is funding that the state has provided to do that as well. So we're hiring for immunization positions right now. We're also going to continue, although I can't stress this enough, it is going to have to be scaled and scoped. Our core services that is outlined in the Public Health Act. So we still have all those responsibilities by statute to complete that work. And the last thing we're going to do is tell our staff, we're going to take you over here for 40 hours and make you work on COVID for more than 40 hours. People will probably angry at me by hearing me say 40 hours, but we're going to take you over here off of your work, tell you to work 100% on COVID, and then expect you to get your same other work done as well. Just as I shared with you at the last board meeting, that is not the message we're sending to our staff. We're making sure that they know that if we are asking them to shift their work into COVID, which we've got a lot of staff, I couldn't tell you the exact number, but I bet Marielle, if Megan was on here, I know she would be able to for sure. But we have a large amount of our staff that have shifted their work to work on COVID. We need to support them and not expect them to do 2 or 3 jobs. So we're going to continue to keep that message loud and clear. We'll continue to give you updates on what that looks like. And it's going to be important as we move into 2021. But we are going to continue to focus on the advancement of health equity. It is, I don't even have to say it, but it's extremely important right now. And the opportunities and the necessity for us to advance equity at this point is critical. And it also provides opportunities for us to continue to move this issue forward. And Boulder County has been a leader in this. We want to continue to be a leader in this. We'll be bringing you a resolution at the next board meeting on equity specifically. And we've got to continue this work as we move into 2021. So the county is also very invested in this. I'm very excited to say that there's more conversations with the county and investments, not just from Boulder County Public Health, but a partnership with the county around this as well. More to come on that next month. We also don't see any reduction in the importance of mental health or substance abuse, right? Our plan was to work with the schools. We had met with them. We had started to put our plans in place. And we are certain at this point now that the schools don't have the bandwidth to be able to continue that work in the short term. Doesn't mean that it's any less important. It just means that we're needing to step back from it. As I just said a minute ago, when we have to step into COVID, we have to step out of other things that are also important, and there's impacts no matter how we look at it. So I want you to know that although mental health was critical working with the school districts, that is not going to be something from the FIT plan that we're going to be able to continue to work on for the next several months until things settle down. There is still a lot of other work that continues to move forward in the county that we are very heavily invested in. And you can see some of that in the director's report, the youth-focused work, the OASIS work that we're doing, and the other mental health work that we're involved in. The Behavioral Health Hub, as a follow-up from the Omni report, will continue. It just won't move at the pace that we wanted it to move before we knew that we had COVID. So some of that other work will continue, but we are going to have to step back and make sure we're taking realistic and balanced approaches. And the other positive thing that's happening is the early childhood work that I've been talking about and the development of really a primary prevention system in the state of Colorado with a specific focus on prenatal to 1 is moving forward. There is still a lot of investment in that, both from a state level and a local level. Casey and the Children's Bureau has notified Colorado that they are a tier 1 state, which means we are a lead state, not a follow state. And it brings, still don't know exactly all what it will bring, but it will bring a lot of technical assistance and support from Casey directly and from the Children's Bureau directly to Colorado to help us implement the system at a statewide level. So that was really exciting news about 2 weeks ago. And that work is going to continue to move forward. And the last one that I was going to highlight, even though there's a lot of things to highlight, is climate change was the other one where we have we came to you and said we're going to incorporate this into our strategic plan. You probably remember 6 months ago, our staff brought forward incredibly influential data relative to the importance of climate change, and we agreed that it needed to be incorporated. There's a Metro working group that's working at the region, as well as some other state partners now that include a lot more than just our Metro partners that are invested in this work, and we have to keep it moving. But again, it may not be at the pace that we initially wanted this work to happen. So we're continuing to look at that and think about it, and we'll continue to move that forward as we move into 2021. And then we are definitely not in a place with Oracle that we thought we were going to be, and that again is part of the reason why the county is not able to yet close their books from 2019. So we are going to have to continue to focus on spending time in the system, making sure that we're doing what we can based on the limitations that are in the system. But the bottom line is all the things that are in that strategic plan about the systematic administration as a foundation on which to run our organization have not changed. It's just as important as it was then. And again, it may take more time than we had hoped, but it's still a major priority for us. We also have been working on filling the non-COVID positions, such as our deputy director, the harm reduction coordinator, finance manager, and multiple other positions across the agency are in the process of being filled. And we had to take a step back on many of those, as you know, because we didn't have the bandwidth to continue filling those positions while everybody was working so many long, arduous, complex hours around this response. But we are getting back to a place where we're working to fill those positions now, which is exciting, and it'll be a challenge because we'll need to make sure that we can support the folks who are in those positions as we move forward. And then just again, I think the closing thing for me is you're going to see that we are advertising for a lot of COVID positions. Indira is on the phone this evening with us as well. I could answer more questions when we get to the COVID update relative to that. But we need to have people who can come in and come out of our system as outbreaks occur. And I want to talk about this specifically because it's really important. We can't just hire 40 people. Actually, I think we need to have 28.5. But we can't just hire all those people at 40-hour regular FTE positions because we don't have 40 hours of regular FTE position work for them. We need people to be able to step into those positions when we have an outbreak so we can control the outbreak, and then we have them step back. So we're focusing on hourly positions that allow us to do that. And like I said, we've advertised those positions to the entire county. Human Resources has spent a lot of time with us focusing on advertising those, getting them out across the county, telling people what's needed, why it's needed, and making sure there's flexibility and support at the county level for that. In addition, we've brought our own staff, like I said, from environmental health, community health, family health, and other places within the organization to also support this work specifically in our own organization. So we're hiring, recruiting internally, and I think, as you all know, we didn't get funding from the state until just over a month ago to be able to do all this. We didn't have any confirmation of funding. So anyway, we're on a good path now. We're moving forward, and you'll hear more about that as we get to the COVID update. And at this point, I'll turn it back over to Marielle, who she'll walk us through this budget presentation, and we'll see what kind of questions we have.
Hey Jeff, this is Morgan. Before Marielle comes back over, can I ask you a quick question about those positions you're hiring for? Do they have to be county based? Is there a reason why they couldn't be remote from anywhere?
Yeah, no, they don't have to be county based. We're doing, Indira could confirm this, but we're doing the majority of our, if not all, of our investigations completely remotely. If we had to deal with an isolation case that needed enforcement, anybody could coordinate locally with us via via the phone or via telecommuting. So I don't believe any need to be here. They can be located anywhere. And Indira, do you want to just confirm or make sure I'm on the right track for that?
Yes, that's correct. That they can be remote because we're all working remotely right now.
Great. Just thinking, I was just thinking about if you're having problems recruiting people, like, where else might we advertise these opportunities, especially if you're trying to recruit bilingual folks. So anyway, Indira, maybe I can connect with you offline if that is in fact a challenge that you're having in terms of recruitment.
We are very excited to report that we had over 300 applicants in a 5-day period.
Oh, sweet. Okay, you're not having a problem then. You're good. Okay. Sorry, I thought there was an issue recruiting. It sounds like you're fine on that front.
We're good. Thank you, Morgan.
Okay, cool.
All right, so I'll keep moving us on. And this slide basically is a little snapshot of what Jeff was talking about as to where we are with the budget. So right now we're doing the study session and we'll come back in October to do more recommendation. And then in November and December, you would approve. I mean, in January you would approve, but I also wanted to give you the county dates. So just to be more in link with what BOH is doing. So on October 13 is when Bcph has to have their budget ready for Boulder County, and then Boulder County will approve the resolution in December 8th. So as you can see, those dates fall within what the BHOA would be doing as we move through this 2021 budget. The schedules did shifted a little bit due to COVID, and we appreciate your patience since we've been a little bit right behind getting this to you guys. And I'm going to move to the next slide. The next slide is basically the funding sources for 2021. I will give you some of the highlights of the differences between 2020 and 2021. So as you all know, the county decreased about a 2%, and in that funding is mostly because of PACE and KICP. With that move, it also decreased the county tax funding, which is the sustainability tax, which was all mostly PACE, so that funding also decreased by a 3%. On the local side, because of PACE, also we decreased a 5%, and that came from the city of Boulder for PACE program. On the positive side, we did receive an increase of 7% on grants from the state to manage COVID-19. So some of those four are some of the biggest highlights. The other ones are pretty on the same. The major highlights is county decrease, county tax decrease, and the local due to PACE, and then a huge increase due to the COVID-19 grants. So that's what our funding sources look for 2021. Any questions that I can address on this slide?
No, Maryville, nothing about the budget. I just need to interrupt. So if somebody is walking or doesn't have their phone muted, can you please mute your phone? Because it sounds like somebody's getting wind across that mic. It's a lot of background noise. Or if somebody can control it from the county, it'd be great if we could just all mute.
All right, I'll just keep moving then.
Oh, sorry, Marielle, this is Morgan. I do have a question about the county funding, because Bcph has historically received, like 45%, right, according to your slide here, 45% of the budget, and Jeff just talked about, the county trying to control for expenses. Are we anticipating that is there going to be any challenge with Bcph continuing to get that level of support from Boulder County?
No, the challenge is not us getting so basically it would just be a flat funding. So whatever we have in 2020, that's what will continue in 2021. The decrease was mainly due because The salaries that were in pays that were from the county were shifted. So you see that decrease there, but the 2020 to 2021 would be a flat funding, same as 2020.
Okay, and so we're not, thank you for explaining the drop there, but we're not concerned that the county is going to have to make cuts to the amount of funding, because I know every year we have to go and ask them, right, for the amount of money, so.
Right. And also keep in mind that in 2021, they're not considering merit or COLA increases. So that's why they're saying is flat funding. So whatever we got in 2020, we'll get in 2021 as of right now.
Hey, man,
Great.
it's Jeff.
Thank you.
Can I jump in on one more thing here? So, Morgan, the only caveat to that is that we generate somewhere between 150 and 250,000 in those vacancy savings. So if they sweep those, then we may lose a portion of those vacancy savings.
Got it. Okay. Thanks, Jeff.
And then we really don't know what happens if, let's say, I mean, all these estimates for revenue are based on the assumptions that they've made. If things take a turn for the worse, or, I mean, it could change later. We just don't know that right now, right?
That's correct.
Yeah, and Greg, just to emphasize that point, if you remember 2 months ago, literally, we were talking about hiring freezes because it looked like we were going to lose over $500,000 just based on what we were hearing from the state, cutting positions due to COVID, those kinds of things. We had no money in the pipeline for any positions for COVID at that point from the state. So things can change pretty dramatically, and we'll just make sure that we're keeping you up to date as we learn new information.
Yep. Okay, thank you.
All right, I'll move us to the next slide. So, and these are our expense categories. And as you can see, well, this in 2021, we're forecasting 82% expenditures on salary and benefits. And that's mostly due because of all the COVID-19 hires that we're currently doing. So that's a 5% increase from last year. The other major highlight is the decrease in operating, which has to do a lot with all the operating that PACE and KICP were bringing in through the county. So as you can see, you can still see that PACE shift as a big impact from the revenues and the expenses for Bcph. All the other professional property and other services are pretty similar to last year. It was mostly the salary and benefit and operating that had big differences or small, bigger increases than 2020. So those are the two major highlights for this slide. Any questions that I can answer for this slide? Okay, I'll move us along. And this slide basically represents every basically division within public health. We have the admin, the strategic initiative. This year we added special projects, and our special projects consist of mental health, the HEC committee, and any COVID-19 grant that we receive as of today. As you can see, the difference between revenue expenditures is quite substantial. And we're hoping that with fund balance and getting additional help from the county, those are addressed. The environmental health, community Cs, and family health are pretty similar differences from 2019. So they were not big gaps. The only one that had a different shift was family health, and I know if Andrea's on the line and that she could help us answer any additional concerns you have about family health. Other than that, the only difference is that we added special projects just to address those priority projects that we're working on. And the gap between what our revenue or our expenditures are forecasted for 2021. We also added our fund balance in this green column in admin, so we can represent what we have fund balance for expected 2021. Any questions that you have about this slide? Okay, I'll move us over. This is our revenue and expense comparison for 2021 through 2018. As Jeff mentioned, our 2019 books are not closed, so we hope that the numbers are close to what we currently have. So this is basically a representation of what's happened from 2018 to 2021 and the differences. And on the far right side, you can see all the comments that I have as to, you know, a decrease in county, and I've already talked about that is mostly done through PACE and KICP. The same thing for county taxes, the loss of the sustainability tax for PACE. And the local is the decrease of grant from the city of Boulder, and we also have the Gary Piton grant that is not to be renewed in 2021. In the state, we receive increases due to COVID, so that's where you can see that big jump in there. At the federal, we have a few small grants that are not renewing in 2021. There is an estimated fee decrease. We don't know what it would look, so we hope that in December we have better numbers to represent and give you as what the fee decrease will look like in 2021. The private was the Gary Piton that closed in 2020. And then we have our holding and reserves for 2021, and those shift this. The expense is the same. Increase in grant expenses due to COVID, decrease in rebates for operating in PACE, and then we have, you know, a decrease in professional and other that are due to PACE and KICP shifting. And I think those are all the overviews I have, and we'll provide you with finalized data at the December meeting that we'll have a better picture of what this will look like for Bcph. Right, I'll move to the FTE changes, and I think Jeff touched a little bit on this one when he said that we are bringing in quite a few case investigators and tracers. So as you can see, admin had no change from 2020 to 2021. The big increase is the special projects where we are bringing those 18 case investigators and tracers as of now. The other change is in the family health, and that is due to a WIC reorg, due to loss of funding and several staff that were shifted to make the WIC program work better. The community health has a shift FTE of 1 increase, which was the hire of the vaping educator. And we had another employee that became a full FTE. So that is the total of the 1 FTE change in community health. Then we have environmental health, and once again is the changes of PACE and KICP moving to the county. And the last one would be the communicable disease, and that is that they are not rehiring for one of their positions for the works program, so that would be the decrease in 2021. So this is kind of a small picture of what the salaries will tell you in the increases on expenditures for salaries and benefits for 2021. Any questions from this slide? Okay, we'll get us moving over. I think we've talked about a lot of PACE and KICP, so as you can see in this slide, it's all the decreases of PACE We lost the sustainability tax. We lost revenue from the city of Boulder. We also lost revenue from the general fund from the county. And then a small loss from WIC, and it was due to the restructure due to continue flat funding and minimal losses. And in addition to that, there is no per se loss funds in here, but we also wanted to make you aware that we lost the PACE indirect cost once PACE moved to the county. There is that possible fee decrease due to COVID, since we still don't have a clear picture of how many fees we haven't received due to COVID. We're still unsure on what the total amount is, but that is a possibility and awareness. And then, like Jeff mentioned earlier, the salary savings losses that we'll have in 2021, where if we have a vacancy, the county will take all those funds back and Bcph will not be able to keep them. I think that's all I have for this slide, so I'm gonna move us over. This is our unassigned fund balance. As you can see, is the highest that we've had. And that has to do because there were no merit increases this year. So the reserve looks very good because we've not having to use some of that reserve to account for merit and COLA increases. So once all of our expenditures get applied, the fund balance for Bcph would be at 8.4. That's basically what Jeff will have and the board will have to say what you guys will use that money towards. So, or fund balance at the end in 2021, after it gets applied, it would be that $1.5 million. I know, sorry, I lost my slide. The 4.4, and in my next slide, it actually, I can provide you more of where we are at 8.4, and also reminding you that Bcph has to maintain a fund balance at a minimum of 5%. So there is some percentage to work with, and then on the next slide, I can reference where we would be if we would issue to the 5%. So this is the final slide of the presentation, and it's basically the fund balance for Bcph. And it just goes into the high level details of where we are. So we are beginning with a 3.5 million fund balance, and then we go down and subtract everything that Bcph has in line, like restricted funding that we have, restricted funding for the TABR requirements or the mosquito control. And then we go down as to the commitment we have for emergency preparedness, accrued payroll and all that. So after all those items that are deducted, that's where our total fund balance for 2021 would be, which would be at the 1.5. And you have a 8.4 margin to work with as a percentage to use. And as a reminder, we must keep a 5% balance. So if we, or if the board spends the 5%, you would be issuing about $600,000 out of the fund balance if you wanted to drop down to just the minimum of 5%. Any questions in regards to any of the numbers from these slides?
Maybe I can, if there's no questions, maybe I can add just a couple things here. So I just want to remind the board again that when we are going into the final year, we are always at a negative fund balance typically at this point, because we are making guesses about what we think is going to happen for the end of the year as we go into 2021. And again, reminder is that if we were to apply that fund balance today on the previous slide, then we would be at an 8.4%. And in addition to that, there's another $600,000 in spending that would then take us down to the 5% minimum. So the bottom line is we're in a good position with our reserve fund. And we also want to close the gap between now and the end of the year with the fund balance shortfall as well. So we'll be continuing to talk to you about what that looks like as we move into the next months. But at this point, we're looking pretty good.
That's all I have if nobody has questions.
Thank you for that presentation. This is Morgan again. So Jeff, you said at the beginning, you kind of walked through some of the big picture changes that BCPH is making. I guess my sort of like high level question is about if the budget looks pretty much the same, you know, with the addition, you know, hiring folks for tracing. I guess I just want to make sure that, are there any other opportunities budget wise to support staff who are probably continuing to work well beyond what they have ever been asked to work before, and just thinking about how do we make sure that there's budget enough to continue to support what will likely be a high rate of burnout as this goes on and on and on. So just, I'm sure you're spending a lot of time thinking about that, but I just, you know, when it comes to looking at the budget, is there money being set aside at some point, or how are you thinking about that from a budget perspective?
So there definitely is, and between the DOLA funding and the ELC funding, the CARES funding that's coming to BCPH directly from CDPHE, that total together is around $3 million. I might be a little off, Marielle, you can correct me, but between those two funding sources as a distribution from CDPHE, one of those funding sources, the DOLA funds, have to be spent between now and December. So we have limitations in terms of when we can spend that funding. The other funding, the ELC funding, is currently slotted for 30 months. And the way that we've been told that 30-month funding works is that we get paid out over a 30-month period of time, which doesn't exactly make sense to me. And it's one of the things that we're following up with the state on, because we need to front load a lot of those positions as we're going into the fall, which is what we're doing. Just so you know, Morgan, we are hiring up positions beyond our ability to pay for them in the short term. And if they don't change the 30-month payout, then we would have to front load that with covering with our own reserve fund. We hope the state is going to be willing to change that. I don't know what ability they will have to do that or not, but we would catch up in arrears. We would just have to cover some more of that funding on the short run. But that has not stopped us from moving forward with requests for what's needed in the department. When we get to the end of the COVID update slide, I'll talk about some of those positions that we're hiring and where they're going. But it's the burnout thing is a real thing. There's no doubt about it. Even if we spend, we've already allocated all of that funding, and we could still use some more positions. But before we can bring in any additional positions, and as you all know, I know I've talked to you about this every year, that reserve fund is really short-term expenses. We don't want to get upside down and have be investing reserve fund dollars in long-term expenses that will carry us into a negative place. But if we can get a shift in the state payback policy, then we may have the ability to be able to expend a little bit more of our reserve fund on some shorter-term positions that would allow us to bring in some more staff in addition to what we're already planning on. But until we get that verified, we are looking at covering a portion of those positions in the short run. We're not expecting, and I really hope that we don't need those positions for 30 months. I hope that we need those positions for 12 months to get the majority of the work done, and then we'll be able to scale back some.
Thanks, Jeff. That's pretty sure helpful context.
I think that's all I have for you guys. So,
Does anybody else have any questions on Marielle's presentation?
Is it okay if you don't mind? We have all of our division managers here tonight, and they're here to support any kind of questions, but I want to open it up to them to see if they have any comments that they want to make, since we have them all on the phone here tonight.
This is Indira. I'll go first. Morgan, thank you for your concerns about the staff and the work increases. We do feel that the hiring that we're engaging in this month is really going to help us develop a system and a team-based approach in which people can get the respite that they need, and have like set schedules in which they'll be working. We also feel that in addition to what's happening with our hiring, there's also a state platform that is coming out for specific to COVID. It's called Damagi. And right now, one of the burdens and one of the issues that we're having is a lot of the CEDAR system that we currently use wasn't built for a pandemic. And so as a result, we're having to do a lot of paperwork. And so we feel that this new COVID platform is really going to enable us to have a smoother transition from case investigation to contact tracers, so we feel like the timing of this is all really positive. So I am feeling like this is going to start giving people the break that they need and set us up for a sustainable long-term approach that will allow us to identify all the cases and respond as quickly as possible, and all the contacts. In addition to this, we've been also working on what we're calling the priority populations, and those that's work in progress, but we are really trying to focus on those that have some medical vulnerabilities, but also some social vulnerabilities as well. And I'm sure that we can discuss that at a future point. But I'm happy to also talk to you offline. So thank you for the question, and thank you all for your support.
Any other takers? Jeff, you want to bring us home?
Yeah, so what we'll need from you, if you don't have any suggestions for us, is just if we'll bring this budget back for formal adoption next month. But if you all as a board have any recommendations that you want to see when we bring this back to you, now's the time to let us know. You don't have to vote on this tonight. The formal vote will be at the next meeting. But this is really your opportunity to let us know if we need to be focusing on something else.
I think the only thing I would be curious to know is, you know, I don't know that it's necessarily a comparison between now and next year, but how much you expect staff, you know, how much of your total FTE are dedicated to COVID right now? How much will be dedicated once you bring on the COVID funded positions, so the temp positions, right? So it kind of gets to what Indira was talking about and Morgan and had mentioned in terms of that alleviating some of that, you know, uncertain workload on existing staff. I think that would be curious, even if it was just a wag. I'm not looking for an exact number.
Sure thing.
Okay, if there's no other recommendations from the board members, we will move on to item 6 on the agenda, which is the update on current COVID-19 pandemic.
All right, and I will share my screen here. Bear with me for a second. Hold on. Almost there. Sorry, that took longer than I expected. Tell me when you can see that.
Not yet.
Okay, let me pull that back for a second and reshare, because I think I just reshared my screen is what I did. All right, how about that? Should be there in a second.
Looks
Yes, can see it.
Okay, thank you. Sorry about that. Technical headache for a second. So what I'm going to do here is I just want to, each time we have a board meeting, my goal is just to make sure that I'm bringing you up to speed on the latest data that we're seeing and what the latest conversations are as well. I think you all know that this is published on our website on a weekly basis. In addition, we meet weekly, actually 2 times a week, sometimes 3 times a week with the Metro Denver Partnership for Health, and are tracking regional indicators along with the data that we're tracking for our own county. So this is our case numbers, and this was as of today. Let me get rid of this little. This was as of today. Megan provided me an update this afternoon. Megan Noel, I want to thank her. She and her data team, along with Emily Payne and Kelly, they've been incredible in this whole entire response. They've been tracking all these data sets on a weekly basis. We send a data set of almost 50 slides out that go out to all of our city administrators, our mayor's group, and our legislators, and they get literally over 50 slides of data that go through not just COVID data related to cases, hospitalizations, and those kinds of things, but mobility data, data that tracks what our mental health, suicide, both visits in the hospital as well as attempts look like. So there's a whole host of data that our staff is tracking that I can't tell you how much I appreciate that and what they're doing. If the Board of Health wants to be added to that weekly update, I am happy to add you to that weekly update so you get that same set of slides. They're pretty long, but Emily or I could answer questions on pretty much any of those. So you can see in our case counts here that we are on a slow upward track. We have a lot of variability. And just as a reminder for the board members, this was our surge. Our stay-at-home orders went into place. Safer at home, we came down. This was the hill event that caused the high surge that we leaned on CDPHE for so heavily to help us get under control. And then we've had kind of the slow, steady increase. And I'll have it slide a little bit later that'll show you where the governor's office has been thinking that we are relative to social distancing level. But when we were in this phase in here, we were around 80% social distancing level. So just keep that in mind as we're looking through these slides. This is the total number of cases, hospitalizations, ICU status, and then deaths associated with age groups. And just as you're hearing in the press, the majority of the challenges for us is in the 20 to 29-year-old age group. That is where we're seeing the largest majority of case growth. We're also starting to see some case growth in the 17, 18, 19-year-olds as well, based on what our epi folks are telling us. And we're also seeing the highest impacts that has been consistent with this entire outbreak in our older population, which you see represented in the orange graph here is deaths These are hospitalizations. ICU is the light blue. So we continue to see the biggest impact in the older population, but we see the largest case growth in the younger population. This is the Metro Denver. I'm sorry it cut off a little bit of this legend up here, but this is the Metro Denver Partnership for Health, and it's 7-day average new case reports. And you can see Boulder is down here on the red. In all of these data pieces across the Metro Front Range, we are pretty consistently one of the lowest in the entire Metro Front Range. This is Broomfield. This is Douglas County. So Douglas, us, and Broomfield have consistently been low in all of the measures that we're looking at across the Metro Front Range. And these
Sorry,
are
Jeff, are those adjusted for population size? Or those absolute new cases?
This one is not. This one's a 7-day average, but we do have a graph that's adjusted. It's a rate graph. We're still in the bottom. We're still probably second or third in the rate graph that is adjusted for population. We have been consistently throughout. So I'm happy to send that to you, Morgan, as a follow-up. I'm sorry I didn't put it on here. This is total state cases, and this is new cases per day, 3-day average. And you can see the state's kind of gone through the same thing that you saw in that Metro graph, where we had an upswing in the original, we went down. And these new cases are not unexpected. So, you know, as the governor, and we talk with CDPHE and we talk with the Colorado School of Public Health, they 100% were expecting new cases as safer at home restrictions start to get lifted. And as we started to see some of this growth, that's why the governor put those restrictions back in place, because not only was he seeing some growth in our cases in the state, but he was also seeing the explosion in cases from states surrounding us. And when that happens, if you looked at our exposure graph early on in the COVID-19 response, some of the first cases, well, the very first case came from travel, but there was a larger proportion of the cases that came from travel in the early part of the outbreak. And as those safer at home orders get lifted, and as other states have lifted orders, as you've seen, I'm sure, in the national news, you've seen larger outbreaks across other states, and we start to see more associated travel exposures. I wish I had included a graph. Maybe I can do it in my next update. But when you look at where people travel to Boulder from, it's California, it's Arizona, it's Florida are 3 of the main places. Those were severe outbreak states. So we know we had some risk when those states were having explosive outbreaks. And you know, luckily I don't have the national data here, but from a national perspective, cases reached a peak a couple weeks ago, starting to come down. The number of states that had severe outbreaks were in the 30s when I was doing presentations to City Council a couple weeks ago. And now they're down around 9 states or 10 states. So we're starting to see a decline in the number of new cases. And Colorado has been smart. I think the governor acted at the right time to put the bar restriction back in place and some of the other restrictions back in place because it stopped the continued growth. So we are obviously working on a weekly basis with the state health department and with all the Metro directors in the region and talking about all this stuff. This is our confirmed hospitalizations due to COVID in Boulder County. You can see this was the high in the outbreak. We came down. We are starting to tick up a little bit, so we're keeping an eye on this. We don't have any issues with bed capacity or ICU capacity or anything like that with the hospitals. As you know, we meet with our hospitals on a weekly basis. So anything we're seeing in these graphs, we're talking to our hospitals about. Andrea Pruitt, who's on the phone, is chatting with them weekly. So she is hearing, and so is our CITER team, which Indira is also involved in. And they are chatting with our hospitals weekly. So we're getting everything that we're seeing in graphs is being ground truthed through direct conversations with our hospitals on a weekly basis.
Sorry, Jeff, to interrupt you. Sorry, this is Morgan. Is anyone else having problems with not seeing the slides move forward? I'm still seeing the new cases by county graph.
Me too.
Oh, yeah. Thank you for bringing that up. Let me Don't know what's going on, why that's happening, but let me pull this back and put it back up again and see if that helps.
Now I can see patients hospitalized due to COVID
Okay,
by
let me just
Thank
go
you.
back so you can see the other couple that I put up. The last one you saw was this one?
We see Jeff. Keep going ahead. Keep going. And that was the last slide where we were hung up. Now you can advance.
All right. So this is just the state cases. So again, I was saying this is where the governor decided to put some of those orders back in place, stemmed. And we're going to see another slide from state hospitalization perspective. Here's our COVID-19 confirmed cases. Thank you, Morgan, for sharing that. Here's our COVID-19 confirmed cases that have been hospitalized here in Boulder County. And again, we don't have any issues with availability capacity at this point. This graph shows new hospitalizations by county. And these are weekly totals from week to week. Again, Boulder County is down here in the red. This is Broomfield and again, Douglas. So our three counties have remained consistently low throughout the entire outbreak, and we continue to remain consistently low now. This is the state, and what I focus on usually here is just the blue line, which is currently confirmed COVID-19 hospitalizations. Again, this is when we were ticking up. Governor put those, reinstituted some of the restrictions, brought this back down, and we're pretty sustainable in Colorado at this point, and we hope to continue that as we move into the fall.
Hey, Jeff, this is Morgan. Sorry, quick question about the hospitalizations. Do our demographics in terms of who's we're seeing the largest case numbers from, which you've said is 20 to 29, does that, that probably has something to do with our lower levels of hospitalization. Does that align at other parts of the state? I mean, are the parts that are seeing higher hospitalization rates having different demographics being infected? Or I'm just wondering about
it's
what
very
might be.
Very consistent with this chart that you see right in front of you across the state. So if you looked at this in Jefferson or Mesa or El Paso, you're going to see a very similar distribution to what you see right here.
So does that mean then that they are seeing higher numbers of 20 to 29-year-olds hospitalized than we are? I guess that's my follow-on question.
No, I would say it's pretty consistent. And Indira, if you're on the line and you know that for sure, could you jump in? But it's pretty consistent across counties in terms of what that looks like.
Right. So the thing with COVID is that you have an increased risk as you get older, which is what you see here, not only for death, but for disability or any kind of morbidity associated with it. So what we see in this graph is similar to what we see across the rest of the state. So as you get older, your risk for being hospitalized due to COVID or death from COVID increases. Does that help, Morgan?
Yeah, it does, Indira. I was just wondering if our rates of hospitalization have been low compared to the rest of the state, and the rest of the state sees similar distributions of cases in age categories. I'm wondering if that means that in other places around the state that they are seeing younger people hospitalized than we are. I guess I'm just trying to figure out what is making the difference up between our hospitalization rate and other counties around the state.
I think that's a good question, and we should probably come back and answer that.
Yeah, I can tell you the last time I looked at our hospitalization rate, and these are rough numbers, but they're going to be pretty close. Boulder County's hospitalization rate was around 59 per 100,000. The state's is around 113 at a statewide average, and national is a little bit higher than that. So that'll give you at least the hospitalization rate of Boulder comparative to the rest of the state. So this is the number of tests we're running per day. And the study that was referenced earlier, the Harvard study, says that Boulder, they break out by population how many tests should be run per capita. And for Boulder County, based on our population, it's 495 tests per day. We have zero problems getting our tests run. We have capacity for actually well over 500 tests per day. The bigger challenge has been the turnaround and testing. And so we have, and when I say 495 per our population per day, that is based on testing all symptomatic people in Boulder County. So Boulder County has the ability, does not have any wait lists, any concerns with getting people tested at that level. And we can also test the asymptomatic folks who have been exposed to the positives in our population. And our capacity from our hospital, we have about, I don't remember the exact number, but it's somewhere around 15. Here, let me get this log back in so I don't lose you. We have about 15 sites in our county or so that are running tests. And based on the number of people that can test in our capacity to run multiple more tests than what you're seeing on this graph is there. So that is not an issue. The bigger challenges that we've been having have been getting free tests. And we are working, we have met with the governor's office and are talking with his governor's office about a way to try to make more testing free to people. And the biggest issue, as I think you're all pretty aware of, is the turnaround on test time. So we were having some delays that were plus 10 days. That kind of delay is a major and significant issue, especially if you think about needing to do contact tracing, those kinds of things. We need turnaround times within 72 hours. And the state is building some capacity towards it. This is definitely a statewide issue and a national issue, without a doubt. And we have been pressing on the governor's office. We've written a letter through MDPH. CalFO has submitted a letter as well, pressing the governor's office to get more capacity at a statewide level to be able to turn around tests faster. And that has been our biggest challenge, is not being able to turn around tests in a quick period of time. But we don't have any issue with our capacity. In that same study, the study talks about needing a positivity rate of less than 5%. You can see our positivity rate here has been consistently lower than 4%. We're getting down closer to 2%. So we're testing enough people in the community that's not an issue. Some of the things that will challenge the system is when people are talking asymptomatic testing, if there is not a prioritization on that would further tax our testing system across the entire state. And if it wasn't done appropriately, again, in high-risk populations, things like that, then it's going to just make our turnaround time for tests even longer. When you hear about CU or the schools testing, which they've both embarked on testing, they are doing that independent of the state. So they are not testing through the state. They're also not testing through LabCorp or Quest, which are the backup labs that are used by the state of Colorado. They have secured contracts with separate facilities to run the tests, so it's not taxing our system. So I just want people to know that, because that's been a big conversation here in the last couple of weeks. This is projections from the Colorado School of Public Health and Anschutz folks who've been doing the modeling. Biggest message here is if you look at, these are the social distancing numbers on the bottom down here. So you see 65%, 55%, 30, color-coded responded. And what the state, remember, we were around 80%. So when we were in a stay-at-home order, we were around 80%. So we would have a completely flat line graph around 80%. And we have bounced back and forth at a state level to as low as less than 50%. Again, which is why the governor's office said we are going to start to put more restrictions back in place, because we're starting to see cases rise. We're concerned that we're going to exceed our ICU capacity and our hospitalization capacity if we don't do something. So their target is a 65% target to keep in this range right here. And at a 65% target, they can have a real slow growth in cases that are not likely to extend out and exceed our hospitalization capacity, which is the target that they've really been using at the statewide level. So that's been sort of the fine balance between looking across the state at what others are doing, setting up the protect our neighbor metrics, which I think were very smart. So the protect our neighbor metrics, which Boulder County is not likely to enter into, very few counties will likely be able to get to protect our neighbor, because before we were able to loosen restrictions more, we would have to have more contact tracers in place, more case investigators in place. We would need to be able to, we would have a surge plan in place, and we're working on a surge plan now. But the contact tracers and the ability to have decreasing caseloads for a 2-week period of time, and there's different metrics associated with that, but that's the basic measure, is really difficult for really anybody to meet at this point in the state. So you're not going to see too many counties move to a protect our neighbor level, which they're calling phase 3. Bottom line is we need to maintain somewhere around 65%. We're somewhere in this range, 55, 60% is what the best predictions are from our modelers at Anschutz at this point. And then some really great news. What you see here on this slide is the results of our survey for masking, which thanks again to Susan's team who put this together, ran this, organized it, coordinated it. We'll be doing this once a month to just double check how things are going. Really great positive results. And I think one of the best things I heard come out of the statewide mask order was relative to Douglas County, who I think you're probably all aware was talking about seceding from Tri-County Health Department when they put their mask order in place, which was much less restrictive than the states or ours, as an example. And the data that I just saw last week from Tri-County showed very similar numbers like this in Douglas County, which is awesome. So we know that Tri-County was doing some of those surveys as well previously, and they were in the 50 to 80, high 80% range. And we're seeing high 90% since that order passed. And in fact, that is what was shown in the research that came out of, I think it was Washington. I can't remember, to be honest, exactly, but there was some research that showed that just for states that pass a mandatory masking order, masking will increase. And it is in fact what we're seeing across our jurisdictions and other jurisdictions. And then last two slides.
Hey, Jeff, could I interject for a moment?
Yeah.
Yeah, I just wanted the board to know Megan Noel designed that Sentinel survey on the masking and social distancing, built a team, designed things, and has this routine way to have this professional result on a monthly basis. So credit goes to her.
Yeah, really, our staff, again, I can't emphasize enough how much they've really carried the ball in this entire thing. So I really appreciate everything that everybody's done. So this is just a high level overview of some of the COVID positions that we're hiring. Again, we've got 100% of that funding spent at this point. We're hiring case investigators and contact tracers. We are hiring education specialists. There is a very strong focus. Again, I think this is another one where Boulder County was looked to as an example across the state. So we set up, and we still have set up, business hours. So we've connected with the chambers across the county. Boulder Chamber has led this for us and coordinated it for us. We reach out to all of our businesses. We have an entire team that includes code enforcement folks from across all, I think it's all of our jurisdictions, but I'm not positive it's all of them. But we have a pretty large team that is doing on-the-ground assessments and looking at and responding to complaints. They meet on a weekly basis, so they get updates on where's the hot spots, what are the places that we're hearing issues with. And then we have a team that reaches out to those places and does one-on-one direct work with them. And that's been led by Jesse Rounds, who is actually loaned to us from Dale Case and is working full-time for us. So again, an example of the county stepping up to support an area that's really important in order for us to be able to have the kind of outcomes that you saw on that previous slide around masks as an example. So we have a strong focus. We've also hired a couple positions to help support that team. We've hired we're in the process of hiring these positions, data specialists, education specialists. So Emily's team and Kelly and Megan Noel, as Susan mentioned, they need assistance because there's a lot of work that they've been doing, so that we're bringing folks in there. We are looking at hiring a resource coordinator position for our high priority populations. We know if we looked at our Latinx population data, we would continue to see a unacceptable inequity among our Latinx population, where they are having a higher percentage of diagnosis of COVID comparative to the percentage of the population. And we know that we need to switch that. If you think about those populations specifically, we know that those populations are the ones who are going to feel least comfortable about coming to a government organization. So we have to work with our cultural brokers, with lots of our folks like Amistad and our center and Sister Carmen and others who are in our community already, to help make sure that we're bridging the gap for those populations, so that we reverse that inequity that we see right now. So there's lots of opportunities for that moving forward, and we'll be bringing some resources into there. We're also hiring a bilingual communication specialist. And as you heard before, and Morgan, thank you for bringing that up, just the importance of bilingual case investigators right now are critical. So if any of you are thinking about anybody you know, please push them over to, I don't know if it's directly to Indira, but let somebody, either Indira or myself, know, so we can get them linked into the process. And then finally, we've got the state has invested resources in immunizations for flu, because we know that if we don't do this in the fall, if we don't get as much flu vaccine out there as possible, it really, there's a high likelihood it could overwhelm our hospital system. So there's a massive push, both in terms of marketing campaigns, but also in terms of bringing resources onto the ground to help really get flu vaccine out there as we move to the fall. And this is the last slide. I wanted to talk about this because I've shared a couple emails with all of you on the Board of Health. And the schools have been in a what I would consider an untenable situation. It is a extremely difficult situation with so many pressures from so many places, and with a lot of national experts saying that it is the risk for kids getting back to school versus not. It's more important to have them back in school and do it in as safe a way as possible, versus having kids. So we know kids have lost more than a year, mental health, some abuse situations. And we know that having kids not in school is difficult, both for parents as well as for teachers and for children especially. So Harvard, the American Academy of Pediatrics, you've seen the places that have been supporting getting kids back to school. They have been, from a data standpoint, talking a lot about wanting to watch the data, but wanting to get kids back to the maximum extent possible while creating 6 foot of space, masking, and doing all the things that you've seen come out in guidance from Harvard and other places. So there's been a lot of conversation around schools. Our districts were going to go back with a split schedule, and they decided not to do that for a couple of reasons, several reasons. But the main reasons, number one, was the state health school outbreak guidance made it pretty difficult for schools to not be disrupted and to lose teachers. So that was the number one issue that caused our schools to say, we're going to go online at least till September 22nd. And the second thing was, and the third thing was really probably the second most impactful, the teachers that were exempted because of high risk were significantly high in both districts, but in Boulder Valley School District specifically, it prohibited, once the teachers that exempted and met the exemption were identified, it prohibited them from being able to do any kind of mixed in-person teaching. So, and then the third thing is just the trepidation of teachers and parents. And, I'll have, 20 parents call me and say, this is ridiculous. Our kids have to be in school, and I'll have 20 parents who call me and say, this is ridiculous that kids are going back to school. So it's really difficult for those districts, and they're in really, really difficult positions. And the best thing that we can have happen is for a vaccine to be circulating out in the community, for us to have more herd immunity, and to be able to be back to something that is not so stressful and complex for all of our school districts across the entire state. And the last thing is, I've been talking a lot with Dr. Urbina, who's our chief medical officer, as you know, and Steve Federico, who is the local chapter pediatrician for the Colorado chapter of the American Academy of Pediatrics. We are meeting with state epidemiologists. We are meeting with all the metro directors, and we are talking with folks who are experts in these areas to watch what's happening with that data and make sure that we have the latest information and that we're sharing it with our districts and with each other. So I'm sorry, that's a lot of information, and it's a long board meeting tonight. So I knew it was going to be a bit longer than we usually go, but I wanted to make sure I'm thanking you for listening through all of this, because it's pretty important things happening right now. And I'll stop there.
Ooh, yeah, that was a lot. Thank you, Jeff. Good update. It's great that the mask compliance appears to be 95 to 99%. It does make me wonder, though, a couple things. So it seems like the social distancing decrease obviously probably has led to that July resurgence in cases, right? And again, it was at about the early April level. It seems to be coming down. That's good. So with the high adoption of mask wearing, and assuming that's going to continue well through the winter, I wonder if we will see like a co-benefit for flu transmission because of masks. But my other concern is mainly economic, is that while the summer weather has allowed a lot of these restaurants to have outdoor seating options, that's gonna come to an end in probably November. And that really has me concerned with the ability to kind of still stay viable with reduced in-person restrictions. So, that's one of those economic factors, I think, that is unclear to a lot of budget forecasters. What's the fall and winter going to look like? And are we going to, in essence, be kind of back where we were in April and May, where we didn't have a lot of people congregating in public places?
Yeah, we have been having these conversations as well, and I think it's a real concern for multiple people. And I don't think, though, that the governor is going to allow us to be in that place, to be honest. I think you saw that he made some difficult decisions that I know caused a lot of phone calls to that office. And I think that CDPHE and the governor's office has been prudent. And this is especially true in the last 2 months, where we're talking about really difficult decisions around variances and protect our neighbor and where the state needs to move. And so I think that we are in a better spot than we were when we were back in March and April. That obviously is yet to be seen, and we'll be watching that and talking about it. I can tell you that from the Metro Denver Partnership for Health, we have made at least 6, 7. These are all public recommendations that have gone to the governor's office, specifically when we start to see concern or we're worried about some of those things. We have asked the governor's office to extend the mask order. So my assumption is it expires in 5 days, I think, or 4 days, I forget. But my assumption is he'll extend that order and we will have it in place. And I think we need to keep watching the data. I don't know, Indira, in terms of the flu, is there any thoughts you have about mask benefit relative to that as we move into the fall?
I definitely think that the intersection between COVID and flu this fall is definitely going to be a challenge. But I am hopeful because preliminary data that seems to be coming out of Australia, who has their flu season before us, seems to indicate that the social distancing or physical distancing and the mask wearing seems to be reducing the flu impact as well. So I do think, Greg, to your point about the physical distancing, I think that is one area where we probably need to be putting a little bit more emphasis in. The mask wearing, as you saw from Megan Noel's data, is looking really positive and looking really good. But we hear stories from our investigators of parties where family members get together. We just heard one this weekend, and they can end in tragedy. And so we're going to have to think creatively about how we message to our community about being able to keep those safety precautions in place, reducing the number of people that you have over. Don't have your uncle or grandpa who might have a chronic condition over. So I do think that you raised a really good point in terms of the businesses and the feasibility. I think that is a good question that we're probably going to have to start reviewing. And so I'm hopeful that the governor extends the mask order and that we can do more collectively to get the word out about that physical distancing.
Thank you. Any questions from board members?
Just another round of thank you to everyone who is working so hard and putting in so much time and energy into trying to keep our community safe and healthy. And it's a long haul, and your work is really deeply appreciated.
I second that. Thank you all.
Thanks, board members.
Okay, well, I know we're running pretty long here, Jeff. So does anybody have any, we'll move on to item 7 in the director's report. Does anybody have any burning questions for Jeff? I didn't have anything that can't wait till next month, Jeff. You know, just it seems like things are going pretty well on the mosquito front, West Nile front, so that's good. And so I can reserve until next month.
All right. Well, I will, if there's no questions because you've got a director's report in writing in front of you, I'll opt to not provide any additional emphasis, and we can move forward when you're ready to.
Okay, I believe we have items in old and new business. I know we have at least one. You know, I would just say kudos to the environmental health team, particularly the air quality team, Bill, Colin, Cindy, working with a lot of local governments on this most recent rulemaking around Reg 7. So that's yeah, I think that was a really solid outcome. I know it was a lot of work, and I appreciate the coordination from everyone involved. And you know, it's a great model of how we continue to leverage our different areas of expertise to really benefit the common good. So I'm really proud of them.
I have, is it okay if I jump in with an announcement?
Go for it.
So I am very sad to say, but very appreciative that this is Mackenzie's last board meeting. And I can't tell you, Mackenzie, how much I've appreciated you jumping into this board. Mackenzie, I think if you don't know, Mackenzie was appointed to be on the board on February 15th, 2019, and just have so much appreciated your investment in public health. Your participation has been awesome. You've showed up for all the board meetings. You've been an active member. You've looked out and asked good questions about the health of our community. And I only wish that we had you longer, but I know we can't have you longer. And I know that I'm so excited about baby Winnie, and don't even know how old baby Winnie is now, but I know that you're certainly enjoying the new addition to the family, and we are going to certainly miss you so much on the board. We do, because as most of you probably know, if we were in person, we would be presenting you with a gift tonight. But since we can't do that in person, you should expect a farewell gift to be delivered to your house. And I just want to tell you again, to get on, to be part of a board of health like this, you're not getting paid for it. You're having to show up and spend hours outside of your normal work, and it's all for the benefit of the community that we're serving, and every board member brings that to this, and I very much appreciate the time that you've put in with us, and I'm going to miss you, and I wish I could be there in person to give you a hug, and we know we can't do that, so I wanted to make sure that I was paying tribute and to let you know that you do have a gift coming to your house.
I'll keep it short because I know that we're still over time, but I really have also appreciated being part of this board, and I would love to have stayed on longer, but I think we're moving out of the county, so in the interest of you guys finding someone that could stay for the full 3-year term, I did not resubmit my application, but I have also very much appreciated this experience, and I've learned a lot from every single member that has ever participated in our meetings, and I've enjoyed going to all the meetings. So thank you very much for this opportunity, and hopefully I'll continue on with a board of health in a different county sometime.
Well, thank you.
Yeah, thanks, Mackenzie. I will echo Jeff and say that your attendance and your commitment was highly valued. So good luck.
Thank you all. Good luck to you.
See, I think that, is there any other new business from the members? Okay, it is 7:56 and we are adjourned for the evening.
Thank you, Greg. Thanks,
Thank
Jorge.
you, everybody.
Thank you.
Greg.
Yeah, take care.
Have a good night.
Thank you.